I'm Laura Caravella. I'm an internist and a pediatrician, and I'm also certified in hospice and palliative medicine. I'm happy to talk with you today about the Greater Flint Health Coalition's advanced care planning project called Your Health, Your Choice. It's a particular pleasure because I think this is just such an important project. It's important to really be able to bring a broader knowledge and awareness of this concept to our patients. I think it's difficult for all of us to contemplate what might be at our end or how that's going to go, and a lot of times the healthcare system is really so complicated that sometimes it almost seems to have its own momentum. And so for patients, I think to be able to have the opportunity to think about this when they're not sick and they're not in extremis and things are not going so fast is really a gift to them. It takes a while sometimes to be able to think about these concepts and clarify, and also to have an opportunity to talk to all of the important loved ones that people have in their lives. And so this project enables people and also I think really gives them the knowledge and the opportunity to address these issues early. I think it's also tremendously helpful for the families of people, and in particular, I've had kind of the sad situation where a patient is really sick and they're not able to speak for themselves anymore, and their family is left to make a decision, and unfortunately they have not been able to have that conversation with the patient. And so even under the best of circumstances, even for physicians' family members, I find that people are, very much prone to really second guess themselves about these decisions. So it's a real gift for families to have a very clear discussion and a document to back up that discussion that really allows them to feel confident that they are indeed acting in their loved one's best interest and along their wishes. So this project is really special for that. The project is really a massive effort to be able to make it so that the whole county has the opportunity to have these discussions, and to do it in a way that's efficient, and that these documents, once collected, can be available so that they're there when people need them. And so the Greater Flint Health Coalition has put together a number of partners, pretty much many of the important partners in healthcare in the county, to make this happen. And I'm very happy to be on the steering committee for this. The Greater Flint Health Coalition's advanced care planning process, Your Health, Your Choice, is a consortium of a number of healthcare providers in the county, and includes representatives from the hospital, the UAW, and many other groups that are important to healthcare here. It is an opportunity, I think, to bring this really to the fore to the residents of this county, and to be able to allow them to have the opportunity to talk with trained facilitators, and also to have their documents stored so that they're available when they're needed. I'm excited about this approach. It's somewhat novel because oftentimes when we have these discussions with patients, we're really talking about, do you want CPR? Do you want a ventilator? Do you want a feeding tube? And that's such a hard question, because what do the patients, they may not really understand the implications of that. They may have seen one instance with a family member or a friend, but the instance might be different. And so we really get into very technical discussions with people, and I think they also find it quite distressing sometimes. What I like about this approach is that instead of asking, what do you want us to do, what do you not want us to do, we're really asking people, if you were to have a serious life-threatening illness, or if you were to have some event like a cardiac arrest, really, at the end of it, at the end of treatment, what would be an acceptable outcome for you? What neurologic outcome in particular? So is it that you would want to be alive at any cost? Is it that if you had the ability to interact with friends and family, you would want to land there and feel that that was an appropriate way to continue life? Or for some people, they might say, you know, if I can't do my normal activities of daily living, then I really don't think that I would want to continue. So what we do is we try to find out what it is that people would find acceptable, and then to work backward from there and try to figure out what the most effective approach would be in order to help them reach those goals. The Greater Flint Health Coalition is training facilitators, and this is also a very innovative portion of the project, because they don't have to be healthcare providers in order to be able to help people get through these conversations. And I think there's a very clear approach that I really appreciate, and that helps people to kind of think through some of these options and also think about who it is that they need to speak to. At the end of it, they end up with a document that I think is clear and concise, and also is a legal document. And then the Greater Flint Health Coalition and this task force is working then to find ways to store this document so that it's available when needed. Physicians, I think, I'm very excited as a physician, and I hope that my colleagues will be as well. I think physicians are very important in this process in that they have a strong credibility with their patients and their families, and really to be able to talk to people and to get the ball rolling and start this conversation is very important. What's nice is that this can be really a time-consuming process if it's done right. It needs to be done so that people have enough time to be introduced to the topic, to think about it some. Sometimes they have to come back. Sometimes they need to contact important loved ones in order to kind of finish this process. So the facilitators are able to do that. And these people will have a central repository, will be able to find names to refer. And so physicians can refer a patient off to the facilitator, and then when the patient has finished this process, they can bring the document back, and it's an opportunity for the physician to go over that document with the patient and make sure that everybody's on the same page and that the document makes sense and that everybody can act on it. So I really can't give this project any more support than I do. I think it's a wonderful project, and I'm very proud and happy to have it be happening in my county.